My name is Dr. Maria Trent, and I'm a pediatrician and adolescent medicine specialist here at Johns Hopkins Children's Center. I give my children vaccines not only because I know it's the right thing to do, but also because I love them. I don't know what I would do if there was something that I could have done to keep them from being sick, and I didn't do it. I also know that they won't be with me all the time in the future. They might make mistakes. They might make decisions that I don't agree with. I think that's what people are worried about. Me not vaccinating them is not going to help them in that circumstance. And so for me, yeah, I think it's love. I think it's important because I have seen the disease here in the hospital. I've taken care of young people who have significant HPV infections, who have experienced genital warts, who have experienced early young women who have had cervical cancer. That's rare, but I have seen it. And I know how difficult that is. And even though many people will clear the HPV infection, they'll become exposed to it and they'll clear it. I can't predict that my daughter or my son is going to be able to be the one who does that. And I'm also a believer in vaccines. I know they work. I know because of the health status we have here in the United States right now compared to countries who don't have access to the vaccines that we have. And as a parent, I see it as a gift. So the vaccine has been tested again on tens of thousands of people overseas and in the United States. Millions of doses of vaccines have been given here in the United States. It's rare. There's a very small subset of people who have had Guillain-Barré syndrome, people who are allergic to some of the components of the vaccine. This may not be the shot for them, but again, those people are really rare. For the vast majority of people, this is a vaccine that's going to be safe and effective for their child. I give a lot of vaccines, but I haven't given it to my own daughter yet. But I'll tell you why I'm going to give it to her. I'm going to give it to her because it's been shown to be effective. It's safe. It prevents disease, and I don't want her to have it. I'm going to give it to my son when he's a little bit older, and because I love them equally, I'm going to ensure that each of them gets the injection, even though I think that she's tougher about it than he is right now. It's because it works, it's the right thing to do, and it's good for their health, and I love them. That's why I give the vaccine, and that's why I am going to give it to my children.